Good morning. Today's program is creating a meal plan right for me, and I would like to introduce our speaker, Nadia Lakhani. She's a registered dietitian with the Dallas Nephrology Associates in Dallas. She serves on the National Kidney Foundation Council in Renal Nutrition, the American Dietetic Association's Renal Practice Group. Oh, I'm sorry, it's not on?
Yeah, you were talking into it. You're not talking in.
Sorry, I could hear me, I thought you could. Our subject is creating a meal plan right for me, the CKD diet. I would like to introduce Nadia Lakhani, a registered dietitian with the Dallas Nephrology Associates in Dallas, Texas. She serves on the National Kidney Foundation Council on Renal Nutrition, the American Dietetic Association's Renal Practice Group, and the Dallas Dietetic Association. I'll kind of signal, I'll sit a second, I'll signal you in 10 minutes.
What does ELD stand for?
Say that again?
What does ELD, licensed or?
Yes, licensed dietitian.
Okay, so it's registered and licensed.
Correct, yes. All right, now I'm a mover, but I can talk loud. So standing at the podium, it's almost like I'm hiding. But if you can't hear me, I'll stand here, okay? So just kind of point at me like you can't hear me, but I can talk pretty loud.
There's another microphone over there.
Portable mic right by the water.
Oh, goody. That's, okay, well, it's still kind of weird to talk like this. All right, we'll try. We'll try. All right. Now, did I have anybody here? I met one person. Anybody else that was in my other session? No? Okay, great. Yes? Yes. We started already.
Did you suggest this?
Not necessarily, but it's a good one. No. But it is actually a DaVita website. It is a DaVita and a dietitian written recipe, okay? We did go through it. I don't know if the preservative was not listed necessarily on the recipe I got, but they might have added it. I'm not too sure, okay? But it is a dietitian written recipe, so it should be okay. In fact, I actually have the analysis, and it was one of the very low ones, so I can actually pull it up together later, okay? All right. Okay. My name is Nadia Lakhani. I am the dietitian with Dallas Nephrology Associates. I work with patients who have chronic kidney disease, those that are not on dialysis. I also see patients that are on dialysis. I do pre-transplant evaluations, and I see patients that have had a transplant. So I kind of cover the whole variety and the whole cycle of kidney problems. So if you guys have any questions, I can more than likely answer in the best way possible, as long as it's not very patient specific, because certain things can't talk about because I don't really get to see your labs, okay? All right, so today's goal is to try to find a way, via diet, to help slow down the progression of disease. Now, I say that with caution, because I can't reverse it. You can't reverse it, okay? But there are certain things that you can do that may help slow it down. A meal plan that can be adjusted. If you can take away just one, hopefully there'll be more than one, but at least one way that you can change how you're currently eating, okay, into a better way, this will be a successful session. And how a dietitian can help you. Now, before I assume, because it's a CKD session, I'd like to know, is anybody sitting here on dialysis? Okay. I'd like to very, very clearly say that there are certain things that do not apply to dialysis patients whatsoever, so please be very cautious of it. My dialysis session earlier was directed for the patients, but CKD, things change quite a bit, and I'll try to point those out as we go through. But if you're on dialysis, take this session with a little bit of caution, especially when it comes to protein and fluid stuff, all right? I assume there's family members in here as well, okay? So you guys may have already heard, as kidney disease happens, some things that you change are very patient-specific. Things that you hear are actually good for you, all of a sudden, are not so great. So these foods that you hear that are not so great for you, they're not really bad foods. Actually, really good foods. They're full of vitamins and minerals, all these fruits and vegetables and things that we may talk about, phosphorus, if that has come up with you guys. These are really good foods. I mean, how many dietitians get to sit there and say, don't have those nuts, or watch how many you're having? Nuts are great, okay? They're so good, but they're just staying in the body a little bit longer, okay? And now they're starting to harm you. So sitting in this room, kidney disease, no kidney disease, okay? Dialysis, not dialysis. What is one thing that we all have in common over here? We all eat food, okay? That is one thing that none of us can get away from. I get a day off from work, okay? Dialysis, you get a day off, okay? From family, I'm going to take a day off, all right? Food is something you deal with every single day. We all do. But we tend to have this love-hate relationship with food. I know I'm supposed to eat this. I should eat this. I should not eat this, but I did it anyway. Okay? I'll be better tomorrow. When does tomorrow really come, right? I mean, we've heard this multiple times. So if food is something you deal with every day, at least 2 to 3 times, why not make it work for you? Why make it so stressful? Like, oh man, I've got to do this. I'm on this diet. Okay? No, it's happening. Be happy about it. It's kind of nice. And what's amazing about it is it's entirely up to you. Food is one thing you get to control. Nobody else gets to decide what's going to go in your mouth, and hopefully nobody's going to take it away from you either. Okay? And it's one thing that affects your body. If I go run 5 miles for somebody, not going to affect anybody else, is it? If I eat that chocolate piece of big chocolate cake, is it really going to affect him? Affects me. Not only do we eat foods that are quote-unquote not great, we usually don't feel good about it either. Forget about internally, okay? Our body's not liking it, but even afterwards, you're like, oh man, I should not have had that. So the guilt factor. Food should never make you feel bad. Food should nourish you. That's what it's for. It should never be a clutch of, this negative constant thing, whether it's mentally or whether physically it's making you feel bad. I have a patient that may eat something like, oh, I had that chili, it didn't really settle well. Your body tells you, okay, what am I going to do about it? Okay, oh, my GI was upset, I had the heartburn. Don't have it. Your body tells you when it doesn't like it, okay? So food should always make you feel good. It should never harm you. So even when things change with kidney disease, when something's harming you, you got to step back and say, this has got to change. Okay? And this is entirely up to you. It should not be my husband telling me, oh, this is bad. I heard it in the session. Why are you doing it? No, it's your responsibility. Okay? They're telling you because they care. I'm telling you because I care. But does it really affect me? It affects you, okay? So whatever I talk about from here on, I really want you to think about how you can apply this to yourself, and if this is something you can stick with. People make changes all the time. Can you stick with it? Got to make permanent changes, okay? If you can't do it forever, as your body applies, don't make that change, okay? Find things that you can stick with, find success in it, and then you get to the next step, okay? All right, so what do kidneys do for us? Huh? Oh, okay, sorry. All right, so what do kidneys do for us? Healthy kidneys. They do quite a bit. Usually, people know about, they make urine, okay? They filter out the blood, okay? If all the blood filtered, it's only like about 1% of it is actually the urine, okay? So it filters out the blood, but constantly, all the time. It's an involuntary function. You don't get to decide when the kidneys are going to work and not work. It's not like I wake up and, turn this on, going to bed, turn this off, okay? I'm about to raise my hand. I chose to do this. But with the kidneys, they work all the time. They're constantly working. Now, I like to think of kidneys, just to kind of simplify it, less technical, is to think of them from here on, okay, as a cooking strainer. Okay, what does a cooking strainer look like? Okay, tiny, tiny little vessels on them, right? That's your kidney. What does a kidney, what does a blood vessel do? What does a cooking strainer do? It filters out stuff, okay? It keeps what it needs, and the rest is filtered out, just like the kidneys do. Sometimes with that mesh, though, you can end up losing, depending on how small the particle is and such, you can end up losing some things as well. But the kidneys are smarter than that. Kidneys know exactly how much your body needs. It takes it, and the rest is filtered out. That's kind of smart. But even with, without any kidney problems, all of us sitting here, okay, all of our kidneys are working a little bit differently because my body needs are different than your body needs. Okay? So there's no one person that, we can just follow this one diet. I saw it on the internet. I've got kidney disease, stage 1, stage 2, stage 3. Okay? Doesn't matter. I could have 2 people with 30% kidney function. Okay? And one could be running high in potassium, one running low in potassium. So what do? It's very much based off of you. And your kidneys did that for you. Now we base it on the labs. They also have hormonal work behind them, so they affect your blood pressure. Some people actually end up having high blood pressure after they got diagnosed with kidney disease that may not even have, anything to, the kidney disease may not have been because of high blood pressure, but you could end up getting high blood pressure after. They also produce a hormone called erythropoietin. It's a hormone that tells the bone marrow, who makes the blood vessels? The bone marrow does. But who tells them to do it? The kidney produces this hormone, erythropoietin, that tells the kidneys, it tells the bone marrows, make the blood cells, okay? But when the kidneys are not working as well, the kidney function gets lower, the anemia comes in the picture. And you may need to go get a Procrit shot or some iron for those blood cells to start making and stay healthy. They also help in vitamin D. I think that's kind of cool. So who thought that vitamin D and bones are all affected by kidneys? Okay, we really don't think about that, right? So vitamin D actually comes from the food and also from the sun. You get from the sun, through the skin, then to the liver, and then to the kidneys for the final activation. Well, kidneys are not working as well, the final activation is not happening, and the bones end up suffering because the vitamin D is what tells one of the hormones to take that calcium to the bones where it belongs. But when the activation is not happening, the hormone doesn't know what to do, and the bones start getting weaker. So you guys may be on some ergocalciferol, which is not the activated form necessarily. So that's the kind that your kidneys are still working. Your doctor's like, hey, I'm going to check the vitamin D levels, see how much you need, okay, and prescribe you. Now, vitamin D, though, changes. So you could build up enough needs. The doctor may take you off the medicine, then you may need it again, and then take you off of it, okay? So quite a bit, kind of nice. All right. So kidneys work 24 hours a day, kind of covered this, that it's just involuntary, just do it all the time. And the foods that we eat is what it has to filter out. So what you put in your body's going to decide, do I want it, do I not want it, and it's going to filter it out. So when the kidneys are not working, the waste products stay in the body longer, and this is where the changes in diet becomes really important. So a good plan would help to find a way to slow down the kidney decline. Now, when I say that, once again, with caution, there is research that supports it if it's done right and done with the professional help to minimize the buildup of waste products, okay? Improve nutritional and functional status. This is important. I'm not, you hear somebody say, oh, I lost 20 pounds. Awesome. But it did happen in a month, and I really wasn't even trying to lose 20 pounds. Okay? So there's no 2 patients that are alike. Everybody is different. And then you thinking, gosh, I saw this, I should not eat this, and I shouldn't have that, and so much confusion. And people stop eating. They're just like, I'm just on this cottage cheese diet. Okay? I just don't know what to eat, so I'm just going to eat this all day long. All right? Well, you end up losing the muscle mass. It's not just the weight we're concerned about, it's about your energy levels. A lot goes into when you see a patient, what their treatment plans are, what stage of kidney disease are they in. Stage 1, stage 2. See, one of the things with kidney disease, there's no pain involved, usually. So, if I break my leg, I'm going to get more sympathy, right? I'm going to know about it. I'm going to be taking care of it. I'm going to make sure that I do what the doctor said, raise my legs, take all this stuff, whatnot. But with kidney problems, oh yeah, it's there, So we usually wait for ourselves to be in pain before we react to things, and that has to change. But somebody with kidney function, with stage 1, stage 2, stage 3, stage 4, their needs are going to be different. It's about how much the kidneys are able to filter out. So how does a dietitian help you? Just with a raise of hands, has anybody ever seen a dietitian? Not in person. I mean, you guys can all raise your hands. You guys met with the dietitian, okay, for counseling of, okay? All right, great. So a dietitian really is not just, this, hey, let's have, a conversation about what's popular, okay? Although we can do that too. But when you meet with a dietitian, it's very patient-specific. It's not the stuff that you hear in the media with just one-liners, okay? It's evidence-based practice based on research, and then how it applies to you. Your medical history, what's your lab results, and your personal food choices. So I'm not going to talk to somebody who is Italian about an Indian diet, okay? So when the awesome thing about when you meet with a dietitian is that you can actually talk about how you eat, what you are eating, how your finances are. I mean, everything kind of combined, and will this work for you? Diabetes management. I'm a huge advocate of this. Okay, we'll talk about this in a second. Work with you to get to a healthy weight. Healthy weight. It's not always about just weight loss. Maybe somebody needs to gain weight, okay? So a lot of times I hear the word, I'm afraid to tell people at the airport what I do for a living. I'm a dietitian. What's the first thing that comes out? I'm trying to lose weight. Okay, all right, good to know. And what is stopping you? Okay, what am I going to do? Are you going to meet with a dietitian to tell you fried chicken, baked chicken? Okay, you know this, all right? Most people know these things, right? It's just about the matter of what is it that is stopping you to get to it. So healthy weight is important. Review vitamins, minerals, herbal supplements. I cannot tell you guys how many times I meet with the patient and there is a list of medications, 20 pills. You're thinking, that's a lot, right? And then I say, any vitamins, any over-the-counter stuff? Oh yeah, I take that one thing. Yeah, but like once a week. But I didn't bring it. I don't know what it's called. Okay. Take everything you take. Even if it's, I take it, randomly when I remember, or whatever it is, that herbal supplement. Somebody at church told me I should take this. Okay. Take everything with you to the doctor's office. I'm sorry. Whenever somebody wants to talk, just raise your hand so I don't feel like I'm hearing random voices. It can happen. So just tell me and I'll stop. Okay, I'll stop. This can be very informal. You guys can stop me anytime. I don't mind. Just raise your hand. All right. But take everything that you take because it may not interact well with the medication you're on. Here the doctor's trying to find a way to why your potassium's so high, and I'm trying to find a way why the potassium's high, but you might be supplementing yourself. Okay? So take everything with you. Tums, very popular with patients. You start having GI problems, and it's like, yeah, I take Tums. We're trying to figure out where's that calcium coming from. Okay? So take everything. Right, and then of course we can clarify any diet information and provide individualized care. So first, to get started, number one, why did the kidneys fail to begin with? Okay, there's a lot of different reasons. There is autoimmune disorders, there's genetic problems, I had a patient that was super sad, got in a wreck and just lost the kidneys that way. So there's a lot of reasons to why kidneys fail. But if the two major reasons to why kidneys fail to begin with is due to diabetes and high blood pressure. Control these. I cannot emphasize this enough. Even if nobody in this room is sitting here and has diabetes whatsoever, okay? If you've got family members, you've got church members, this is information to take away that is really important. Diabetes is sugar in the blood, okay? So your blood sugar, your body produces insulin. Here comes the insulin, here comes the foods you eat, it attaches to it, okay? Takes it to the cells where it belongs. blood sugar. Here's a way to simplify it. In fact, you know, an audience here told me that I should be a little nervous because I have a nurse practitioner in the room. So I will have to give my disclaimer that I oversimplify stuff medically, okay, just patient conversation-wise. So, but if you need to jump in and kind of give a different example or a different way to explain it, then please feel free to. I don't mind. But I'm going to say this to simplify it. Here's some sugar, and I take some water. Now let it sit there. What's going to happen to it? It's going to dissolve. Let it sit there for a couple hours, sticky, okay, syrupy. Let it sit there for days. Forget about all the ants we're attracting at this point, right? It's going to get all crystallized, hard, okay? Let's kind of think of that little cooking strainer. You let something like that sit there. It's going to start damaging it, okay? Those blood vessels are going to break. It does not like carrying sugar. And some of the smallest blood vessels in your body are in your kidneys and in your eyes. So people with diabetes start seeing those issues fairly early on, or maybe not, but it's not like diabetes says, oh yeah, failed your kidneys, I'm done. It affects every part of your body. The best way to have put it is that it's a problem. Diabetes is a problem of blood vessels. And what part of your body does not have blood vessels? Your nails. But they're attached to it. If I cut you right here, I'll tell you, you'll bleed. Okay? Every part that is usable has blood supply. So it goes to, and do people who have diabetes get their nails affected? They do. Do they have their hair affected? There's no blood vessels here, right? But it's here, okay? So every part of body has blood vessels. Anywhere there's blood, there's that sugar, and it can damage those parts, okay? Very important to get a control of it. So, hey, my blood sugars are doing okay. Sometimes kidney disease, because things are staying in the body longer, people start noticing their blood sugars are better. Why? My diabetes got better. Diabetes really didn't get better. It's more so the kidney function got lower and the medication you're taking or the little bit of insulin that your body was producing is staying in the body a little longer. So that may come across like it's the diabetes got better. And people start, not taking care of it as much. Blood pressure. Who has ever heard of the word blood pressure? Okay. Kidney problems can create having high blood pressure, okay? So you've got to control it. Another one of them. So blood pressure can cause kidney damage. I take that cooking strainer. I love that thing. I like my kidneys too. And I put it in front of the faucet. Really, really high pressure, okay? It's going to start damaging those little mesh, right? Okay, same thing. This blood that comes to the kidney really, really fast, it can't keep up with it, and those blood vessels get damaged. Okay, so controlling the blood pressure, and what is in your control is the sodium part of it, and we'll talk about that in a minute. Weight management kind of brought this up a little bit. And I have to apologize, I just did a session about 15 minutes before I started this one, so I feel like I said this, but I didn't. I don't know, so if I've said it, I apologize. Anybody in here ever tried to lose weight? 2 pounds, 5 pounds, ever? Think about weight all the time, right? Okay. Who doesn't think about it? Everybody does. Weight is like one of the most popular thing in the market. I mean, talk weight. Now, what's stopping you? Yourself. Self-control. What else? What does it need? What does it take? What do you think? God, I need to get to that thing, that weight loss. What is stopping you? What is it that you're not doing?
Processed foods.
Maybe it's calories, but okay. Maybe you're eating more. Exercise, okay. Important? Right? Did you see a slide that says that, or did you guys already know that? I didn't have that listed on the slide anywhere, right? Okay. You know this, okay? Now, here's the deal. Number one reason to why diets fail. You go out with the goal of, I want to lose 30 pounds. You lose a pound, you've got 29 more to go. That's a little discouraging. You know what? I'll start this tomorrow. Okay? Because, of course, tomorrow's going to be there, right? I mean, I'm going to start this tomorrow. But during that time, you're feeling bad about eating the food that you did anyway. Okay? And you've got to come back. And this is a very self-controlled and behavior change topic. It's not necessarily always the food. It's about what else is going on around you. Okay? So behavior changes. Think about why you're eating it. Are you eating because you're upset? Are you eating because you're hungry? Okay? Go out with the goal, if I want to lose 5 pounds, you lose a pound, you've reached 20% of your goal already. You've got 4 more to go. But after you lose these 5 pounds can never come back. Period. Now what does that mean? It means the changes that you make have to be permanent. So you hear of all these diets out there, okay? You hear, gosh, I mean, turn on an infomercial and you're going to see a name. Do they work? They do, absolutely, yes. Okay, I can actually put every single one of y'all here on a two pieces of pie diet. I'd be the richest person out there. And make y'all lose weight. I can do it. A, is that nutritionally stable? Number 2, are you going to stick with it? After a while, you're going to hate that pie. Like, I don't want to eat this thing, okay? So it's not about necessarily all these extremities that you have to do. It's a matter of what are you doing and how can you change within that, because that's how you can get away from the idea of I have to be on a quote-unquote diet. It's just the amount of calories with the 2 pieces of diet, 2 pieces of pie is just so many calories, okay? You just change the amount of calories and you're going to lose weight. But where you cut them, and the important thing is, are you going to stick with it? So the changes that you make have to be permanent. So you lose these 5 pounds, and then I go back to my old ways. I stop eating those pies. I'm going to gain that weight back. Doing this to your weight is one of the worst things you can do because your body does not know what you're doing and you start conserving the energy. It's like, who knows when she's going to give me that food again? Okay? So it's going to start storing it like that caveman. Okay? So, very important. The changes that you make have to be permanent and they have to be lifestyle changes. Don't look at it in a negative way. All right, diabetes, back to this one. I talked about why, but how? The A1C is your 3-month average. Okay, it's like your body's way of keeping a diary of what's going on. So when the doctor looks at the A1C, it might actually look okay, and you're thinking, well, the doctor said my blood sugars look good, the A1C was fine. Just a 3-month average. So somebody who runs, say, for example, a 200 and then runs a 50, the average is going to look pretty decent, right? The doctor doesn't say anything. There's no way for anybody to be able to help you. The doctor, the dietitian, the nurse, nobody can help you with that one number. Nobody can help you if you check your blood sugars once a day. Can't do it. Okay? When you go to the doctor's office and you check your blood sugar and it was fine, it was normal. Well, was it 4 hours? You know, it has been 4 hours since you ate? Was it right after you ate and your blood sugar was high? They're really reacting on one number. You've got to check your blood sugars. I'm going to share a story with you guys when I used to work at a dialysis center. And so, you know, out of school and not too long. And here I was, check your blood sugar. Before you eat, 2 hours after you eat. Before you eat, 2 hours after you eat. 7 times a day, must do it. And a patient once told me, you don't know what it feels like. I said, wow, you're right, I don't know how it feels. So I got a glucometer from the rounding physician. I said, hey, can you give me a sample? I'd like to do this. I want to see how it feels, because here I am telling the people to do this. And so I started checking my blood sugars. Before I eat, 2 hours I eat. Before I eat, and I eat a lot of food, by the way. I'm like 5 times a day person, so this is a lot. And I'm at the mall, 2 hours later, clean this thing up, I've got to check my blood sugars. For the lack of words, it sucked. It is not fun, okay? It hurts, I agree, it hurts. And it's not convenient. What I learned in those 2 weeks, though, I started to see what I was eating. In fact, not even having diabetes, but your blood sugars. See, your body would constantly try to keep them out, you know, in a range that your blood needs. And even then, I was like, oh, look, the food I ate, and look, that number is a little different than what I woke up with versus what I went to bed with. Number 2, I stopped telling people check their blood sugar 7 times a day. Don't do that anymore. But what I did learn is if I had a choice, if I had diabetes, there's no way for me to know what my body's doing with the food I'm eating and if the medications I'm taking, if they're working together. There's no other way to know other than to check your blood sugars. So you kind of find a pattern, and then you know this is what I'm eating, this is what's doing. So you can kind of follow a pattern. But if I had a choice of, Nadia, you're going to lose your legs if you don't know what your blood sugars are like, or you can hurt yourself on your fingers, what will I choose? Right? That point, when my patient lost the leg, I was like, God, I wish I had done it earlier. That's one of the worst regrets you can have in life, whatever it is that I should have. The should have is one of the worst things to do for yourself. And whose control is it to check the blood sugar? Okay. Got to check your blood sugar. That's the only way for the doctor to know if there is a pattern, if they need to change your medications, if what you're taking is working, if it's not working, if there needs to be any adjustment.
Can I comment on that?
Absolutely.
So actually, you don't have to check your sugar like 7 times a day. The pattern is important.
Yes, I'm sorry.
No problem. So the pattern is important. If you make a diary and just keep writing that, okay, you're fasting, like if you check 2-3 times a week, I think that's okay. If you are recording it and when you go to your doctor, they know the pattern. So for example, fasting is always high, or your after you eat is always high, because we always change the insulin accordingly. Like if your fasting is high, we might need to increase the night dose, or if you are high like during the day after eating, we might need to give you some small amount of short-acting insulin before you eat. So we just need to know the trend and the pattern. So if you are checking 2-3 times a week, but writing it down with the time, so it's fasting, or it's like, after 2 hours of eating, and then you bring the whole month pattern, that's helpful. So the goal is to make things easier. The goal is not to make things which you cannot do.
And so I did not complete my sentence, and she's exactly right. So I stopped telling people to check their blood sugar 7 times a day, and what I instead tell people, depending where they are, if they're only checking it 1 time a day, can you go up to 2? Okay, that's not too bad. If you're checking it twice, can you go up to 3? But I like to see a number that's fasting, what you're waking up with. You haven't eaten anything. What is the number at that point? And then at 1 meal, okay, whether it's lunch or for dinner, before a meal, and then 2 hours after a meal. Okay, now that will kind of tell you the food that you're eating, and also the one after dinner kind of helps, because that shows, hey, I went to bed with this, and this is what I'm waking up with. Okay, so if somebody's only checking it, say 1 time a day, okay, then kind of a 2-week pattern, like a cycle. In the morning you check it, the next day you check it before your meal, the 3rd day you check it 2 hours after, 4th day before dinner, 2 hours after dinner, and kind of follow that pattern. The important thing, though, in this is your consistency in the meals. Okay, if you're eating a lot of sugar at 1 meal and 1 day and the next day you didn't, it's really not going to help much. But really, check it, don't you? I'm just a curious person. I want to know what that did. I want to know what the food did to the sugar. Okay, but it helps, but that is the only way to know, and keep a record of it to take it to your doctor and to the dietitian. Mentioned the hypoglycemia earlier, which is the low blood sugars, happens when the kidney disease comes in the picture, a little bit later mostly, because the body's insulin is staying in the body. The medication you're taking, whether it's insulin or your own body's insulin, may be staying in the body longer and causing those low blood sugar episodes. So the doctor may need to adjust that. Sometimes patients just decide, I'm going to stop all my pills. Don't do that, okay? What happened? Okay, the doctor has no clue you stopped it. Okay, so kind of consult that with the doctor very, very closely. Kidney disease and obesity. When you lose weight, if it was just for aesthetic purposes, how you look, I would not be in this profession whatsoever. When it starts affecting you in your body, if it can actually help your blood sugars, it can help your blood pressure, okay? When it's harming you inside, you gotta change some things. When you're eating the food that, or you're thinking, God, that fried chicken, okay? Think about why and how much. It's here. When you eat the foods that we love, cakes, pies, cookies, okay, it's up till here. Why do we eat food? Why do you eat food? Other than for energy, but taste, right? Starts here. In fact, it smells good one, because you have a cold, don't have a good appetite, okay? Don't have a good taste. So it starts here. Once it's going in your body's not loving it. So how much you have, there's 2 types of people. One that's, if I have it, I can't stop myself, okay? Quantity. The other is the quality. Okay, that's really important. We talk about portion sizes a lot. Don't eat as much, don't eat as much, don't eat as much. But you have to know yourself. You know what? If I have a small piece, I might be okay. The small piece definition changes a lot for people, though. Okay? So you have to decide, hey, I can stop myself at 2 bites, 3 bites, pushing it. Okay? So you can still enjoy the foods that you like, but you have to know how much is okay for you. And if it's something that you can't stop, then might as well not have it. But you have to decide, how worth it is this? Is this worth harming yourself? All right, any questions? Can you guys read that? It says, I try to eat healthy. I never sprinkle salt on ice cream. I only eat decaffeinated pizza. And my beer is 100% fat-free. I'd like to get away with that one. All right, so now the part that you guys are here for. What are parts of a renal diet? A renal, kidneys, okay, kidney diet, all right? So this is fairly popular. Calories. Where do you get calories from? Protein, carbs, and fat. Heard of those? Fluids, we'll talk about a little bit. Potassium, phosphorus, not usual words that you hear before kidney disease comes in the picture. Okay, these are minerals that the kidneys filters out. It takes what it needs and the rest is just filtered out. When the kidneys are not working as well, you got to be careful on how much you're having of it. Sodium. New word? To anybody? All right, we know sodium. Okay, so we'll talk about that. Plays a huge role. And then the vitamins. So where do you get calories, energy from? For me to move around, I need energy. I need to eat. You need to have everything, carbs, fat, protein, very important. We're going to be focusing on protein, but there's really not, you can't really have just one thing. I'm going to eat protein all day long. Can't do it. I'm going to have sticks of butter all day long. Fat. Can't do it. Okay? You have to have the word, the terminology, balanced diet means having all of them in the right quantity. Of course, you meet with a dietitian to know how much you need. It's all calculated based on you, your weight, your age, frame size, activity level. Not going to talk to somebody who's sedentary versus somebody who runs a 5K, all right? So there's no one-size-fits-all type of thing for anything. And your goal weight, like I mentioned earlier. Protein, you need it. How many of you guys have heard low-protein diet for kidney disease? Low protein, low protein. No? Not no, low, L. Low protein, I should be on a low protein diet, okay? All right, so has anybody heard no protein? Okay, good. All right, so low protein diet, okay? Now, you need protein though. Your body needs it. It helps in repairing your cells, okay? It helps in your immune system, helps with growth and maintenance, and it can be used as energy if needed. When the healthy kidneys are working, they take it, okay, and throw it out the waste product. Just take the protein, and the rest of it that comes out of it is just kind of spilled away. But now, it's staying, the waste product is the BUN, okay, so it's this waste product. When the protein is broken down, the waste product that comes out of it starts building up, and it's a little hard on you. Okay, people have diarrhea symptoms like, oh, I've got that bad taste in my mouth, I'm more nauseated. Some people start having this aversion to foods, like I can't stand that red meat anymore, I just can't have it, right? Okay, so it's the waste products that start building up, and this is why the amount of protein you eat has to be watched. So too much isn't good, because if you're having too much, there's a lot of waste product coming out, and there's some symptoms, nausea, vomiting. Now there may not be symptoms though. Low protein, meaning too little, isn't good. I've had a lot of patients that just stop eating protein, or they're having like just the least minimal amount possible. Bad idea. If your body needs it. If you don't get it, your body's going to break down its own muscle mass, which is even harder on the kidney. So you got to know how much. Once again, can have the similar symptoms and may not even have symptoms. Where do you get protein from? So, good, there's a variety. So there's animal sources, okay? And then there's a vegetable protein. This one's not as popular, but with kidney disease, everything kind of changes. Pre-dialysis, dialysis, transplant. Before dialysis, we tell people, hey, just watch how much. We're going to talk about how much. But with patients that are on dialysis, they have to eat a lot of protein. Because the dialysis, you don't get to choose what to take out of you, so you take out everything with the dialysis, so you have to constantly replenish yourself, and you end up losing a lot more protein. So the amount you eat with dialysis is very different than pre-dialysis. With pre-dialysis, research now shows that the plant proteins, their byproducts are not as hard on the kidney. So when was the last time anybody over here tried, say, a soy burger? A soy burger? I'll tell you what, 5 years ago when I tried it, I hated it. It was disgusting. 5 years later, it's one of my favorite things. Okay? It actually tastes good. They've come a long way of how they make it and kind of making it tasteful, and their texture is better. But plant protein should be incorporated as part of your kidney diet because you're trying to get the protein, but sometimes you might just get bored of the same old, meat stuff, or you're thinking, gosh, when I eat it, it doesn't make me feel good. Okay, but you still need the protein. So plant proteins are a great substitute. And slowing down the rate of kidney decline, it's just a matter of you're not getting as much, so it's not as hard on the kidney, and so it kind of helps out the kidneys a little bit to not do as much work, okay? Include a variety, you need it all. Examples of,
On the soy burgers, or we've seen the black bean burgers, the protein's fine, but then what do you
potassium and phosphorus comes in the picture. Yes, we'll talk about it, of course. So did you know that even meat has potassium and phosphorus in it?
Yeah.
Okay, all right. So you're going to get it from even the meat, okay? Now, I'm not saying to eliminate the meat whatsoever. In fact, we're going to go through that over here in a minute, and I keep saying that, so we should just get to it. But I promise I'll answer that question, and you'll see. But example of, so this includes all of them. It's just kind of adding a variety and adding other kinds of the protein in your diet in addition to the meat as well. So how much protein do you need?
Can you go back to that
Absolutely.
just for a minute?
Oh, and may I just mention, I'm so sorry, this session was actually technically completely different. About a week ago, we were supposed to have a chef while I'm talking, and this session was entirely too different. And so then I had to change up my slides, and the slides are not in the packet for that reason. So email me, I'll give you all my card, or call me, and I don't mind emailing the entire slides or mail it to you guys, whatever works, but all of it, I have more education stuff that I had to kind of take away, but just email me and I can send these slides. So if you
Your email out.
I will give you the card at the end of the session. Okay. All right. So how much protein do you need? Now, in the last session I did for AKP, it was in Dallas, and this was one of the popular part of it. This is a little extensive to go through, but in the reviews, they really liked it, so we'll go through it. With kidney disease, one thing you do not want to do is Atkins diet. Cannot go on high protein. When we say low protein diet, it's really not a low protein diet. It's just about how much your body needs. We just tend to eat a lot more of meat items than our body needs. So all we're doing with low protein diet is how much your body requires for it to function correctly. So for the guidelines, here's an example of 0.6 to 0.75 grams per kilogram, very important, for CKD. And of course, it needs change if somebody has been losing weight, they're not eating well, they're out of the hospital, they've got surgery. And this peritonitis, meaning somebody who's he's on peritoneal dialysis, so it needs change. So here's an example. Person that may weigh 150 pounds. Number one thing you do is convert it into kilograms. So you divide the pounds by 2.2. Very important. And then you multiply it, 0.6, and then 0.75, take an average. Here's an example I kind of created. How much protein you're getting from each thing. So see, you get the protein from peanut butter. You're going to get protein from bread. You're getting the soy burger, cooked beans, almond milk. These are your these are your vegetable proteins, okay, not the high biological ones. You need the animal protein. The other part of it is 3 ounces of deck of cards, okay, chicken, turkey, any kind of meat. And so that makes up for about, you want to make sure the calculated version, you get at least 50% of it from the high biological value protein. So you're getting the protein from the meat, about 50% of it needs to be. Well, otherwise, your body actually starts breaking itself down, okay? So you're kind of combining both. The kilos to pounds, I had a patient that tried to do this, and sure enough, it was like, oh yeah, 1 gram per pound. Okay, that's like 220 grams of protein versus 100 that I meant, okay? So very important to convert it into kilograms for you to be able to use this example. This is just an example. Okay, this is why you need to meet with a dietitian to talk about how much your needs are, what your labs are doing, how your phosphorus is, where your kidney function is. Somebody with stage 2, their potassium and phosphorus may just be fine. In fact, like I said, I don't know if I said this, or I said it earlier, 2 people with 30%. Somebody could be fine in potassium, and phosphorus does not need to make any restriction unless your labs indicate to do so. So if a dietitian's telling you, hey, it's okay to have the soy protein, it's because your other labs may be fine, or they might be restricting it based on what's going on with you, okay? But soy protein, you do get all the amino acids, and it's not as hard on the kidneys. Any questions? Protein, this,
I didn't get it at all.
Okay, that's fine.
So my question is, on the right-hand side,
Mm-hmm.
is that what we eat in a typical day?
okay, so this example, I'll kind of talk a little bit differently. Going back to this, okay? How much protein do you need? It's calculated on you, okay? And a lot of times there is this confusion of, I need to be on a low protein diet, okay? And low protein does not necessarily mean no protein, one. And two, it's really not a low protein. It's just how much. If I were to calculate my needs right now, okay, no kidney disease, no CKD, nothing, okay? This is about 0.75, 0.8, okay? It's about how much I need. My body requires for it to function. Okay, so with kidney disease, a lot of times when when we do a diet recall and such, patients are just having a lot more protein. So we just come back to how much you need. The purpose of the next slide is just to see an example of how the amount of protein that's calculated, at least 50% of it needs to come from the animal source, and the other can come from vegetable proteins. Okay, but you need at least this. The purpose is really
So you're saying per
not you. This person that's 150 pounds.
Oh, good, I get more.
Exactly. Exactly. Very good. I'm glad you picked up on that. You're right, okay? Perfect. Perfect, okay? Yes.
You said 50% from meat proteins and 50% from vegetable protein?
50% from high biological value protein, which is your animal protein. Okay, yes. So eggs is your animal protein, okay? All right? So milk is too. Now, for people who have any kind of phosphorus issues and potassium issues, we do say, instead of having like regular milk, there's other options like rice milk or almond milk, which is much lower, and also their protein content is lower. So you're trying to watch your protein, hey, let's get some over here and lower it over here instead, okay? Because I want you to fill yourself up with, some chicken instead of having a whole thing of milk. Okay, so you can have almond milk instead, or soy milk, or rice milk instead. Okay? This slide is not meant to be confusing. Do not take this away as this is for you. This is very different for each person. All right, sodium. Okay. You need salt. I get this from my friends all the time. Oh yeah, my body needs it. Okay, I have to eat some, right? The amount you need, you get from the foods. Even in fact, the freshest of the freshest vegetable is going to have some sodium in it, okay, naturally occurring kind. The kind that we're trying to watch is all these additives, okay, that build up so easily. But why is it that the sodium talk seems to be so popular? My doctor said, the dietitian said, the government's telling me, okay, why is it the sodium affecting me so badly? I'm the type of person, somebody has to tell me to do something, they have to tell me why. Okay, otherwise I'm going to follow it for maybe a week, pushing it 2 weeks. So, why do you need to watch your sodium? Water retention. Okay, raises your blood pressure. So, let's kind of look at it in, once again, a simple way, okay? You perfectly got it right. So, salt holds onto the fluid in the muscle, okay? It traps it over there. It's not anymore in the blood vessel. What are the kidneys trying to do we all know about? Make urine. The kidneys have to work much harder now to get rid of that extra sodium and the extra fluid, because the fluid is now up here. So in fact, I know if I'm going function is low, that extra sodium and fluid, it's having hard time to remove it. So what you can do in your hand is to cut back on the salt intake. Did you notice I'm using the word salt and sodium kind of interchangeably here? Okay? Sodium is a big part of salt, meaning table salt. Okay? So when you hear the word sodium or salt, okay, or you hear salt, you hear sodium, you think about it right away. But a lot of times, you hear low sodium. Well, they're talking low sodium. Did they substitute it with potassium instead? Okay? Got to read the labels. So here's some list of high sodium foods. Salt is salt, garlic salt, onion salt. Okay, very obvious. Lemon pepper is tricky because you don't hear the word salt or garlic pepper. You don't hear the word salt, but it's full of sodium. Okay, just like regular salt is. My popular question before somebody asks, sea salt, still salt. Okay, still salt. It's the most natural thing you can get. Well, what's more natural than sodium, than salt? Okay, there's nothing more natural. So sea salt is still salt. And then a lot of times I hear, I don't add salt to foods. Awesome. Okay, what about the kind that somebody else did? But see, if I was cooking and I overpoured that salt, I'd taste it. I'm like, oh no, this is salty now. I messed this whole meal up. But when you eat out, you don't really necessarily, if I have something, I don't necessarily taste the salt. It doesn't have to be sodium chloride, that table salt. It can be different versions of sodium. It could be monosodium glutamate. It could be sodium benzoate. It could be different types of additive. That's still sodium, okay? Now these things, sodium, what does sodium do? Okay, what does salt do? Works as a preservative. Keeps the fruits fresh a long time. If I'm a manufacturer of a company and I want that thing to last on the shelf for a really long time, what am I going to do? Add lots of sodium to it. Why not? Okay? So when you're eating out or when you're buying items, nobody cares that you've got high blood pressure, kidney problems, diabetes. Okay? They want their foods to last a long time. So you have to be the one that reads the labels, and some are fairly obvious. Is anything new here? Sausage, bacon? We know this, okay? Quantity. Once again, no longer the frequency, okay? It's very hard to stay on a diet and talk to a dietitian and think, gosh, she's taking away all these foods. What am I supposed to eat? I like this stuff. I feel good when I eat it, okay? I'm just going to throw this out there. For example, today is just one of those mornings I must have a slice of bacon. Well, don't have Chinese food the same night. Okay? Just be very mindful of what all are you eating. So, I get this, I have it only once a week. That's one of the hardest things, when you're talking to a patient. It's just like, I have that only once a week. I have that only once a month. Okay? I have bacon only once a month. Okay, that doesn't sound so bad. Right? I have sausage only once a month. I have pizza only once a month. I have Chinese only once a month. I'm thinking, gosh, how am I going to change this? That once a month fell in the same day. Now you gave yourself too much. So if you're going to have it, A, watch how much. B, can you change it a little bit? Okay? And 3, divide it out. Okay? Change it up. Like, okay, I had this yesterday, so I might be careful today, but try not to overload yourself. That filter, you're giving yourself too much. Okay? So, kind of goes on, canned items. This one I'd like to point out, the pickles. Actually, it doesn't say pickles specifically, but pickles. This last week, I had a patient that said, hey, nobody really thinks about pickles, right? You're about to order a burger. Can you change one thing in that meal to make it a little bit better? Okay, I said pickles. Well, I didn't add salt, but pickles did. Okay. The ketchup. Okay. But I wanted to, this patient I had, she said, Nadia, our bodies are like pickles, aren't they? I didn't know where she was going with it. Sure, what do you mean? Well, it's soaking in the vinegar, the water, and the salt. What is it, a cucumber, right, originally? It puffs it up. All the cells kind of expand, just like our body does. Okay, it made sense. So think of your body as pickles. Keep them as cucumbers. Okay, kind of hard, right? We're at 10 minutes right now. All right, 5 minutes. Okay, and salt-free ways, things that are a little bit lower in salt. Be very careful about the ingredients. Number 1, if there's table salt, first thing to go. Here's a trick. It takes 12 tries for your taste buds to get used to a change. Okay? Your body's awesome. It's amazing. You can train it to do whatever you want, okay? Your brain, your taste buds. So remember as a kid, you might like something and now you really don't care for it, or gosh, I hated it as a kid and now I kind of like it. So there's taste buds change all the time, so it takes 12 tries. So the first time you have something that's less than salt, I'm not going to sit here and say it's going to taste great. It's not. It's different because it is different. Is it better? Yes. Okay. Now, it's up till here, but this is important. Okay. Got to make sure that it tastes good. So 12 tries, and then 90 days. Okay. Approximately 90 days, 3 months. Get a calendar, say, I don't like this girl, Nadia. Can't stand her, just don't like her. I'm going to cut back on my salt, okay? And right now, if you're a little bit, okay, is there more room to change? All these items that were listed in just small quantity can make up for about 500 milligrams of sodium, and your needs are about 1,500 to 2,000 milligrams per day. Can add up very, very fast. The 1,500 is usually, if, you know, based on the doctor, if there's a lot of fluid overload or very short term, and if you need more or less, can be decided by the doctor. Limit convenience foods. There's this idea of, oh, it's so much easier to just pick up the food, or frozen items. Some may be okay, but why are we not cooking more? Empty nest. There's only 2 of us. I'm tired after work. I'm tired after work. Okay, I'm not a big cook. There's a lot of reasons to why not. But you get frozen dinners, well, just cook something. You don't have to have leftovers for 4 days, right? Just freeze it. Come back to it next week, okay? You can do alternate things. And cooking is not hard. It's the preparation of it that takes a while, okay? God, I'm home, I'm tired. What am I going to look in that pantry to make? Make a menu out for a whole week. Decide what you're going to have. Do you have all the ingredients? Go grocery shopping. Make sure you've got everything. Cooking doesn't take long. Putting together is not bad. It's about, oh, no, I don't have it, or I don't know what to make. The decision of this today, I just got home, what am I going to cook? But if you've already got it, okay, Monday, Tuesday, Wednesday, one day Italian, one day Indian, one day, Mexican, okay, great. I came home Wednesday, it's not really feeling like Mexican food, okay, but my next day, okay, was supposed to be something else. Well, I can have that because I've got all the ingredients. I know exactly what it's going to be, so I can cook that instead, okay? But you can make larger meals and just freeze it yourself instead of trying to make, buying lots of frozen dinners or even eating out too much. Right now, if you go out 5 times a week, can you cut it to 4? Can you cut it to 3? If you're 3 times a week, can you cut it to 2? Okay? What can you change? Even a little bit of change would be a positive one versus, oh man, I eat 5, I have to go to 0, so I'm just not going to do it at all. Okay? Just change a little bit. Okay? See how you do with it, and then if there is any room for change. Do you guys know how to read a food label? Yes? All right. What's the number one thing to look at a food label? Number one thing that you guys look at? You look at sodium, okay. So I had this thing, 470 milligrams, okay? How much should I have of that food? Half a cup. All right, so number one thing to look at when you look at a label is the serving size. How much is it talking about? There is no regulation on what the manufacturer has to say. They can have 2 products and cut it down to 1/4 cup to make it look like a lower sodium product. Okay, you've got to look at the sodium. And then number 2, I have the whole bag. All right, it was 250 milligrams of sodium, sounds good. Or, oh, it was 250 calories, sounds good. But I had 5 servings of it. Okay, no wonder I can't lose that weight. No wonder my salt is all high. I don't know what I'm doing wrong. I only had 1 bag of chips. So how much did you have?
What is sugar alcohol compared to sugar?
Sugar, wow, okay. So sugar, alcohol is a type that your body will actually not absorb. It does not turn into sugar altogether. It's just so very sweet, okay? It has the sugar in it. It's just so sweet that it takes very little. And you get the sugar, but you don't get as many calories. So usually those are added to sugar-free items, okay? But they're not calorie-free.
What about diabetic for diabetic?
So diabetic, what do you first think, number one thing you look at? Carbs, okay, not sugar. I get this a lot. Sugar, nope. Carbohydrates, what turns into sugar for your body, okay? Huh? Carbohydrates do, exactly, not just the sugar part. So number one thing, though, is the serving size and then how much you're planning on having it. I'm running a little short on time, so I'm going to kind of rush through this a little bit. Question, is this high in sodium? How do you know? Do you see a serving size? Do you look at a serving size? Do you see a serving size there? What if this is talking about like this big old container? Okay. It is a lot. A general rule is if you look at something and it's more than 250 milligrams, it's a good idea to kind of pay attention to the serving size, okay, if you're looking at just a number. But more than likely this is a high product, but got to look at the serving size, okay? Any questions so far? This one says, my diet says I can have 1,800 calories per day. Does not say anything about night. All right, the next two important minerals, I realize that there are people who may actually have higher potassium levels already, but this is very patient-specific to their labs, and I cannot sit here and give you guys a list of things that are higher in potassium because I don't know what's going on with you. Also, potassium and the next one, phosphorus, the two minerals that the kidneys filter out, they only show what you've been doing for the past couple of days. So if I look at just one number, it does not help. Okay? You've got to look at the trend and what's going on with you. If, for example, somebody never really has things that are high in phosphorus, in potassium, right before labs, they had a really great appetite and they had things that are higher, the labs are going to show up. That's a good indication that things are staying in the body longer, but vice versa. I always have it, I didn't have it before labs, did not bring the attention to the doctor. So the important thing is consistency, no longer frequency, okay? If you're going to have it in small quantity, you're having a better clinical picture of what's going on in your body and what the doctor needs to do. Potassium is something that works with your muscles, okay? Your heart is a muscle. Having too much or too little can actually have similar symptoms. Irregular heartbeats, it can even stop your heart. But yes? The doctor in here?
Oh, what was the question?
So the question is, how long does the potassium stay in the body? How long does it stay in the body before it's gone?
I think the kidney, it depends on your kidney function. It depends on your glomerular filtration rate. So because the kidney passes, the blood passes every 5 minutes through your kidneys. So if it's slow, then potassium will be staying in your kidney more longer. So it depends on your GFR, your kidney function. So usually if it's less than 10 or less than 15, obviously potassium will be staying in your system more longer. So there's no, I don't know if number. You want to comment on that? I don't think so there's a time frame for that.
Also, if you have...
So that's why I said about 1 to 2 days. Mm-hmm.
Item, and it's going to be in there for, it's going to be built quicker. And then as soon as you metabolize it, so you eat it, the food's easily digestible, it's going to be in your bloodstream fairly quickly. You would have low potassium if you're on.
We're good? Okay. All right. Any questions about potassium? Some medications can make it go up. Some medications high blood pressure medications that are good for your kidneys can actually make it go up. So this is where the doctor may refer you to a dietitian. If you have not seen a dietitian, ask a doctor to refer you for medical nutrition therapy. That's a term that has to be used. And you can sit down and talk about what's going on with you. My next slides are about phosphorus and about vitamins. Usually they stay in the body longer and they may not interact well with the medications, the herbal supplements. So definitely take it with to your doctor and to the dietitian to make sure that it's okay. Star fruit, don't have it. It's too bad. Oh, let's go through that. One pill that blocks fat, one pill that blocks carbs, and one pill that blocks the kitchen door. This is related to the phosphorus binders that a lot of people have to take to bind that extra phosphorus. But anyway, any questions? Absolutely.
I had a question. I heard just recently that the body actually doesn't need more than 500 milligrams of salt. Is that correct? The doctors recommend 1,500 to 2,000, but the body actually doesn't need more than 5.
You know how hard it is just to even get down to 2,000?
Yeah, I
Right, about how much your body needs, as so to speak, once again, for a kidney patient versus not. And I don't know that number. I have not heard of 500 before, but I'm not sure. 1,500, yeah. It's 2,000 is very, very hard to do, actually. Yes.
If a person wants to keep low blood pressure and low sugar, what would make him be a diabetic?
What caused it?
Yeah.
Could be a lot of different factors. Number one being just genetically, your body's, so type 1 diabetes is where people actually don't have any insulin at all. And in type 2, just age-wise, sometimes it could happen. The cells, the beta cells, they actually kind of get weak, okay? But it could be just genetic. You're going to get it. It's just how fast you got it, okay? Your pancreas changed the amount of insulin that it's producing, and different things can cause it to change. A lot of weight gain can cause diabetes. You're right, yes.
Stays low, sugar stays low, pressure stays low, everything stays low.
Yes.
What would make me a diabetic?
What would cause, if your blood sugars are low, and do you have diabetes? Do you have diabetes?
I'm supposed to be a diabetic.
So your blood sugars may have been high before for you to have been diagnosed with diabetes. And remember, diabetes is where your insulin is still being produced. So in type 2, there could be some production still. Okay. It's just not enough. So as kidney function gets lower, you actually have, this extra insulin that your body's still producing, and it stays longer, and now your blood sugars get better. Make sense?
It's very helpful. Thank you so much. Where is your card?
I do. I'll come back to you in a second, okay? Yes. Thank you. I am so sorry it was a little bit longer. Yes. Yes, I have my card up front if anybody is interested. Just email me or call me. And I'm so sorry I didn't get to phosphorus. That's my favorite topic. I can talk about that all day. But
Look at this online. Thank you. Thank you very much.
thank you so much. I had to call myself, but I didn't get to phosphorus. Oh, really? Was it helpful? Okay. No, two. Yes. There you go. Nice to meet you.
You did as much as you could possibly do.